Okay, everyone, thank you so much for joining us. I'm Pratath Pandya. I'm one of the clinical associate at Cleveland Clinic, and we have Dr. Chris Barnett with us, a special guest, and who has agreed to give us some of his valuable time. Thank you so much, Dr.
Thank
Barnett.
you.
We really appreciate your time.
Thanks for having me.
Yep, no problem. Yep. The first question I would have is that about the critical care cardiology. Of course, it's a growing field. So the first question I would have is if you can just shed some light, about this new and growing field. How is the future of this field, and how do you encourage the upcoming generation to join and look forward to the critical care cardiology?
Yeah, I think we see critical cardiology growing quite a bit in coming years. I think the results of Danger Shock today are probably one of the things that will fuel that growth. And it's a great space for folks who are interested in complex patients, complex physiology, complex hemodynamics. Cardiology is really becoming more and more about team-based care. And critical care cardiology at its core is team-based care. And that's really one of the most important lessons from critical care, from our critical care training, that we bring to the cardiology space as working together as teams. Danger showed us that Impellas there's some randomized clinical trial data to support the use of Impellas. But part of the interesting thing was the risks of placing Impellas. And it's possible that critical care cardiology, multidisciplinary team-based care, cardiologists who have that experience, that training, are present in the ICU, management, who knows, it could reduce those complications.
Sure. Yep. No, definitely. It's an exciting field, and I completely look forward to growing this field further, and hopefully I can be part of it as well. And hopefully many of our viewers and the upcoming trainees also get motivated and encouraged to join the field. About research opportunities, I know you already answered part of it, but how would you see the research opportunities specifically for this field for the upcoming generation?
Yeah, so I think research in critical care cardiology is really growing and evolving, and there's already the Critical Care Cardiology Trials Network has already produced an enormous amount of really important data that's helping us understand how to take best care of patients in the cardiac ICU. I think that this is going to keep increasing. There's a lot we don't understand about simple things like what is really the best vasopressor used in cardiogenic shock, the best inotrip strategy, how should we be sedating patients who are on mechanical ventilation, how do ventilators interact with hemodynamics in patients with shock. So many really basic questions that we don't know the answer to. And then as new devices become available, devices like the Impella, now we have randomized clinical trial data, other new devices will be coming. We're going to have to try to understand how to incorporate those into our critical care practices. I mean, and also, we need to be thinking about what new devices and drugs, what targets of therapy we need to develop. So there's tremendous opportunity.
Definitely. No, that's really exciting. And thank you so much for answering that. The last question I would have is, a lot of trainees might have this question coming up after the critical care cardiology training is completed. How do you see the future in terms of overall job, opportunities, and how do you see career overall as an attending once you are out of the trainee? How do you see that?
Yeah, I think that's also, there's a tremendous change, I think, already happening. I know many years ago when I was finishing my training, it was difficult to find a job as a critical care cardiologist. This wasn't really recognized as a specialty. Now there is very high demand for people trained in critical care cardiology. Of course, a whole separate conversation could be had about how one becomes trained in that space. And I think exactly what these jobs are is still a little bit unclear. We're learning and we're teaching our leaders in cardiology divisions and other employers on what we do, how we work. We work differently than other cardiologists. The way we take call, the intensity of our jobs, what extra training in critical care means in terms of what reimbursement should be for us, what payment salaries should be for us. All of these things are sort of being worked out at this time. And I think as more critical care cardiologists start working, I think we'll understand this more.
Sure.
And more. There's a lot of work actually within ACC to try to answer some of these questions. Hopefully there'll be some data will come out in the next year or so that will help guide us as we try to discover the answers to those important questions.
Definitely. No, looking forward to it. And as you said, like ACC also, we have a separate section for the critical care cardiology. So those all new changes, I think it's exciting for this field, and I hope we can encourage more, upcoming trainees for this field, and definitely look forward to it. Thank you so much again for your time. I really appreciate that, and I hope you have a great way back home. Safe flight. Thank you so much.
Viewers or listeners would like to reach out to us, please do. We're
Sure,
a very
definitely.
community of cardiologists.
Thank you so much again. Really appreciate that. Thank you.
My pleasure.
Thank you.